we will today we will be discussing the dating of normal endometrium, and along with this the dating of the endometrium. So why do we endometrium biopsy is one of the most commonest investigation which comes in a pathology lab, which has got histopathology set up in it, and wherever there is a gynecology department feeding the pathologist, there are numerous endometrial biopsies, and in which dating is an important component, especially in case of evaluation in the infertile woman. And before the advent of before ultrasound based the ovulation was not there, then this was the main method by which ovulation was tested. So the endometrial sampling is done as a workup for abnormal uterine bleeding and for evaluation of endometrium of the infertile woman. And in case of hormonal replacement therapy, when we see whether it is okay, it is not causing any problems, or sometimes the bleeding taking place because of, we just check for it. And the common technique for endometrial sampling are the dilatation and curettage, and the endometrial biopsy, the suction biopsy, and of course the hysteroscopy and the directed biopsy using a hysteroscope. Quite often, these hysteroscope or endoscopes, they are now entering our system quite a lot. So, adequate endometrial dating requires an adequate biopsy. I mean, there should be sufficient number of glands which should be available, and it should not be a totally hemorrhagic smear or hemorrhagic tissue. The lining surface of the epithelium in the fragments, it should be visible, and the basal and lower uterine endometria, I mean the lower parts, they should be ignored, and we always date the most developed area. The inflamed endometrium, or the one that houses the intrauterine device, should not be dated. That means if we find some inflammation or that area may be ignored, especially if we should have sufficient number of glands to make sure that do a proper dating. For example, this is a specimen in which you see only the mucoid material, and there is some hemorrhagic pieces and not a single gland can be seen. So obviously we will rate this as totally inadequate specimen. Another one in which hemorrhage is there and the stromal tissue is there, but no glands are seen. So this will also be considered as inadequate specimen. Another one, now here you can see the glands are there, they are coming, but their amount is the stroma is in majority, it is mainly stroma, and glands are not, just a very few amount of glands are available. So this can also be considered inadequate. A large number of glands and well spread out specimen should be there. Now the menstrual, we must be clear what is the meaning of the word menstrual cycle. That is, the first day of the cycle is of the menstrual flow is considered as the first day of the cycle, and after that proliferative phase is 10 days long. That is, it may vary in different ladies, and it could be considered 9 days to 20 days long, depending upon the variations in the period of ovulation. Then the secretory phase. The secretory phase is always 14 days long. It is fixed. So between the proliferative phase and secretory phase is the day of the ovulation. So day of ovulation is always 14 days before the next menstrual cycle. This is fixed. So whatever is the menstrual cycle, expected menstrual cycle, the date of ovulation is 14 days before it. So in the proliferative phase, we have the early proliferative, mid proliferative, late proliferative, and the interval. So what do we say? If the gland is, whether the gland is straight or coiled, and in the straight gland, it is if the gland is straight, we that is in the first from the 4th to 7th day. About 4 day, first 3 days we can consider is the cycle, is the flow. From 4 to 7 day, that is the early proliferative. Now see, this is the early proliferative phase in which the glands are tubular and the stroma is quite dense. See, this is the high power of this. The glands are tubular and stroma is quite dense. So another one, the glands are tubular on high power. Even if you see, there is no edema in the stroma and there are no vacuoles glands. So as the time passes, gradually the stroma starts becoming slightly edematous. The edema starts becoming stroma starts becoming slightly edematous, and the glands gradually, the edema starts increasing in the glands, in the stroma, and the glands, they start becoming tortuous. The tortuosity starts increasing, and again the stroma, the edema is increasing, and the glands, they in the mid proliferative, the glands become coiled, and edema, it goes on moving forwards and forwards, and that is around 8 to 10 days. See, the tortuosity is increasing and edema is increasing, and in the late proliferative phase, the stromal edema again decreases and a new entity appears, that is subnuclear vacuole. The tortuosity is increasing and the stroma is once again the edema starts decreasing. And if we start seeing here at the base of the vacuoles, small nuclei, they start appearing. See here also, small nuclei, they start appearing, and the gland is proliferative, it is coiled, and subnuclear vacuoles, they start appearing in the late proliferative phase. These, if you see here, so these are the vacuoles, the subnuclear vacuoles, they have started appearing. So after this, the secretory phase starts, and in the early secretory phase, the subnuclear vacuoles, they go on increasing in size, and there are many mitotic figures, and the subnuclear vacuoles, they start gradually they start moving upwards. Now let's see here in low power. You can see there are a lot of subnuclear vacuoles. Another one on high power, we can see lot of subnuclear vacuoles, and these subnuclear vacuoles, basically what they are, they contain the lot of material, the mucoid material, and this mucoid material goes on. I mean, it is basically mucoid material which provides the which ultimately has to be shed to provide the nutrition to the ovum. So another one, look how these vacuoles, they are moving upwards. In this slide, they are still at the bottom of the nuclei, but they will move upwards. There is marked tortuosity, and around the 18th post of or 4th post ovulatory day, these vacuoles, they become supranuclear, and the mitotic figures, they start decreasing. So see, if we see here, the vacuoles, they have started becoming supranuclear. See here, from subnuclear they become supranuclear, and they also start shedding inside the endometrial gland. Basically, they provide nutrition to the ovum, which they assume that it has come, and eventually it will be fertilized. So the secretions in the lumen of the glands, they start appearing, and the vacuoles, they start disappearing, because basically they have shed themselves inside and we find inside the glands lot of secretions. So these are the secretions inside the glands, more glands with secretions, and gradually the mitotic figures, they have disappearing, and the ovum assumes that there is the endometrium assumes that there is the ovum has been is already there. So after this fertilization does not take place, the process starts for beginning to for the shedding of the endometrium. If the fertilization has already taken place, then the process continues and more shedding keeps on taking place, and the stromal edema starts increasing, and by 22nd day the stromal edema is maximum. And if you see here, the stromal edema is quite a lot. Inside the glands, the vacuoles have almost disappeared and they have shed, and more vacuoles they are coming and they are releasing themselves inside the glands. And after that there are on the prominent spiral arterioles, they start appearing in the stroma. These small arterioles, they start appearing inside the stroma, and they bring more and more blood. They increase the blood supply of the stroma and provide the nutrition to the endometrium. Now, however, a new phenomena starts appearing around these blood vessels. A small cuff of fibrous tissue, it starts appearing, which is called pre-decidualization. Gradually, this cuff gradually becomes so big that it starts this periarterial cuff starts pressing the blood vessels, and it is sort of prepares the blood vessels to be shed. This is the blood vessel, and around it a perivascular cuff has appeared, and around 25th day or 11th post-ovulatory day, the island of the pre-decidua, there is superficial compactum or edema has again decreased, and we find that the congestion or bleeding has started taking place inside the stroma. See, this is the blood vessel with its cuff. The edema has started appearing. Blood vessel with cuff, and the cellularity of the stroma increases, and by 26th day or 12th post-ovulatory day, these stroma becomes quite dense, and the perivascular cuff reaches its maximum, that so much so that it starts pressing the capillary cuff, and these glands, they start merging with each other. There is increased amount of various glands and marked stromal edema and bleeding, and you can see that the blood vessels, they start bleeding, and there is lot of extravasation of RBCs inside the stroma, and the menstrual cycle, menstrual bleeding starts, especially if there has been no fertilization of the ovum. This is the congestion which has started because of the collapsing of the perivascular cuff, and the glands collapse, stroma crumbles, stromal granulocytes, they start becoming prominent, neutrophils, they come, mild inflammation is there, and intravascular thrombi, they start appearing. So see here, now these are the cuff, so marked amount of bleeding is already there, and menstruation starts. Marked edema, there is lot of inflammatory cells, granulocytes, even some plasma cells, they start appearing, and in the menstrual phase, it has to be differentiated from menstrual shedding of anovulatory cycle and disintegration of hyperplastic endometrium. This is where the date of collection of sample, it has to be taken at a time preferably in the pre-ovulatory cycle, and so as to prevent any, in case supposing we feel that there is a ovulation is there, not to cause any damage to the ovum. Now I'll show you after this the site which I had promised. Now this is a very good site for understanding the normal histology. It is called histologyguide.com, and it has got beautiful images. So I'll start with the I didn't do the vaginal, I just started with straight away with the here. Now this is the normal vagina. It is lined with the stratified squamous epithelium, and also there is underneath it is the lamina propria, and these they contain numerous transverse folds of the rugae, and there is underneath it is there is a non-keratinized epithelium, and underneath it is this dense connective tissue rich in collagen and elastic fibers, and below it is this, we find that there is a muscularis layer, which is basically a layer of indistinct layer of smooth muscles, a thin layer of inner layer of dense connective tissue, and outer layer of the muscles. And also in this layer there are no Pacinian corpuscles or which are there in the skin. So there is generally which is the upper two-thirds that generates. This is the functional layer, and here we find that there is a columnar epithelium, and branching or coiling is quite less. Then we see the early secretory endometrium. If you see here, it is a sort of